Hi, I'm Dr. Mark Mandel. I offer this video presentation on the dry eye as a means to inform you about the symptoms of the dry eye, the causes of the dry eye, conventional treatment, and LipiFlow treatment. As cornea and dry eye specialists, we're committed to helping you treat the underlying cause of the dry eye, not just the symptoms. The symptoms can range from mild irritation to decreased vision and pain. They tend to be worse in the morning but can progress throughout the day and are often made worse by heating and air conditioning, as well as reading and computer use. Before we talk about the causes of the dry eye, let me explain a little bit about the structure of the tear layer. The tear layer is basically like a sandwich. The water layer, which keeps the eye moist, is sandwiched between a fine layer of mucus, which holds the water onto the eye, and a layer of oil or lipid, which prevents evaporation of the water from the surface of the eye. The two main types of dry eye is the aqueous deficient dry eye, or not enough water, or the lipid or oil deficient dry eye, which is either due to poor quality or not enough quantity of the oil layer. This is also known as evaporative dry eye and accounts for about 65% of all cases of dry eye. The reason this causes a dry eye is that either not enough oil or poor quality oil causes rapid evaporation of the water layer from the eye. Traditionally, we've been unable to measure the oil layer, but now with the advanced LipiFlow system, we're able to measure both the quality and the quantity of the oil layer. Let's go look at a model of the eye showing the oil gland anatomy. Let's first look at an external schematic of the eye. The white part of the eye is called the conjunctiva, and the clear part of the eye, which overlies the blue part, is called the cornea. In patients with a dry eye, cell damage to the conjunctiva and the cornea, as well as the eyelids, can give rise to the irritation, itchiness, redness, decreased vision, and pain. The water layer of the tears is made in a gland up under the upper eyelid. The oil layer of the tears is made in glands in both the lower eyelid as well as the upper eyelid. Once the tears bathe the surface of the eye, they're drained through two small drain holes, one in the upper lid and one in the lower lid, which go through two small tubes into a larger tube and then drains eventually into the nose. Action. Now let's look at a side view of the eye showing the cornea and the lower eyelid. Now remember that the surface of the cornea is covered with our tear layer. Very important to the functioning of the tear layer, remember, is the oil layer. And the oil glands are located in the lower eyelid, and this is a side view of an oil gland. So the oil is made in this gland here and comes out through a little pore on the surface. And there are about 25 or so oil glands of the lower lid and about 25 oil glands in the upper lid. And these glands, also known as meibomian glands, are what produces the oil to prevent evaporation of the water layer of the eye. The conventional treatment for abnormal oil production, also known as meibomian gland disorder, is using a combination of warm compresses and eyelid scrubs, oral tetracycline and omega-3 supplements, as well as antibiotic drops and ointments. Concurrently, we treat the water-deficient component using artificial tears, Restasis, as well as oral omega-3 supplements, and sometimes by plugging the upper or lower eyelid drains with silicone plugs. Most of the time, these treatments are not that effective in establishing better oil flow or quality. The LipiFlow system is an FDA-approved procedure which can establish better oil flow from the glands to the tear layer, thereby increasing the quality and the quantity of the oils and decreasing the signs and symptoms associated with the evaporative component of the dry eye. We first take sophisticated laser measurements of the thickness of the oil layer, and then we determine the number of functioning oil glands. This will determine whether you're a candidate for the LipiFlow treatment. If you are a candidate for the LipiFlow treatment, it's a 12-minute procedure which is performed in our office. We place a soft eyelid cup on the eye, which warms the eyelids and melts the oil. Then, gentle pressure is applied, which expresses the abnormal oils out of the glands and allows new and better oils to repopulate the glands, which then helps decrease the evaporation of the water layer. According to FDA studies, after 4 to 6 weeks, the glands begin to produce better oils, and the surface of the eye begins to heal after years of dryness, decreasing the signs and symptoms of the dry eye. Oftentimes, fewer eye drop applications are necessary throughout the day. Studies have shown that the increased comfort can last for a year or more. It's important to note that this is a treatment and not a cure, but certainly represents a significant advance in our ability to treat the underlying cause of the evaporative dry eye. The treatment is very effective for most people, but doesn't work for everyone. Be assured that we will work closely with you to determine if you are a candidate for the LipiFlow treatment. And if you are a candidate, as cornea and dry eye specialists, we will make every effort to restore comfort and improve your lifestyle.